So I'm just going to talk today a bit about what I've been doing over the last 9 months now with my Masters in Applied Epi. So the Masters of Philosophy in Applied Epidemiology is commonly referred to as the MAE. It's Australia's only field epidemiology training program, and it's part of an international network of field training programs in epi and public health intervention network. So this is similarly considered the same program as to what's delivered in the US with the CDC with the EIS program. And the MA is run by the National Centre for Epi and Population Health at ANU. So the MA aims to develop Australia's public health capabilities and systems. The primary goal is to foster the professional development of field-trained epidemiologists who are competent in using epi to tackle a wide range of contemporary public health problems. And so since 1991, when the program started, there's been 204 graduates, and 23 of those have been Aboriginal and Torres Strait Islander people. And so currently in this year's cohort, we have 3 Aboriginal and Torres Strait Islander people, and last year as well, in the second year cohort, there's also 3 people as well. So MA is a place in a range of field placements for the duration of their program. So most people are in public health units or government departments or research institutes, and there are also a few people who are doing it as part of their existing employment. And we've got a couple this year that are in the same boat. So this is where everyone in my cohort this year is actually placed. So there's 13 of us. As you can see, most people are either in a public health unit, a research institute, or the bottom 3 are actually doing theirs through their existing employment. So as you can see, we're at a range of different locations. And there are a couple of people in Victoria who have spread their placement over two places. So there's 2 people at the Department of Health. One's part-time there as well as part-time at MDU, so the Microbiological Diagnostic Unit. And then the other person who's half-time at the Department of Health in Victoria is also half-time at MDU. So this is the structure of the MA. So the majority of what we do is field placements on the job, learning and training. And then we're required to do 5 pieces of coursework. So the 5 down the bottom, so an outbreak investigation, public health surveillance, data analysis, and then methods and research. And then also a final subject in issues in applied epi. So all of these are on top of our field placement, but also a thesis that we need to do at the end as well. So it's quite full on. But next year there's going to be a restructure of the program, so it'll look slightly different. So the 4 projects that I need to kind of do over the course of my MAE is to establish or evaluate a public health surveillance system, to participate in response to an outbreak or disease of an acute health event, analyse a public health data set, and conduct an epi study. So I'll talk about each of these projects in a bit in relation to what I'm doing. So we're also required to do some additional tasks over the course of the MA as well. So we need to do a late draft of a peer review publication, conference presentation. We also have to teach epi as well. So we've got to teach epi to the first years. So next year we'll teach epi to the first years. And then we also do some lessons from the field. So that's teaching that we'll do amongst our own year level about something that we've learned or think would be relevant to other MAs. And then we've also got to do a writing for a layperson as well. So that can be anything from a health promotional piece to a briefing to a minister or some kind of communications document. Yeah. So at the end of the MA, everything that we do has got to culminate in a thesis. And so the main part of that is our 4 projects where we demonstrate epi competencies and reflect then on the contribution to our knowledge that we've learned and what we've added to the field as well. This is submitted in November next year, and we do an oral viva in December, which is assessed by 2 senior epis, and it's a 45-minute viva as well. So we get bombarded with questions about 4 projects. And then we also learn some soft skills as well. So this is the other part of us all getting together and having a bit of fun and socialising. So now I'll just talk about my MA in the context of my placement here at SAMRI in Aboriginal health and infection and immunity. So my 4 projects. So I was involved in an outbreak investigation earlier in the year, back in June, which I'll talk a bit more about later. And this is completed. I'm using this outbreak as an example also by writing it up as a draft or as a manuscript. So this is going through the process over at SA Health in the sense of just receiving feedback from some of the staff over there. So I'm hoping that piece of that manuscript will be finished by the end of the year. So my second project is my data analysis project, which is underway, and that's analysing SA public hospital separation data and looking at it from an adolescent point of view and looking at the reasons and rates for hospitalisation over a 10-year period. And I'm presenting this data at the Youth Health Conference in November next month. So I've got a busy next 4 couple of weeks analysing the data, so I've got something to present for that. And then my EPI study hasn't started yet, but broadly it's about understanding the health needs of Indigenous adolescents and how primary healthcare can better meet their needs. So this is working with Pete as a party on a project that he's got that he's been funded for, and we'll work with one health service here in South Australia and another health service in far north Queensland as well. And then my final project is an evaluation of a surveillance system, and I'll evaluate Atlas. So next year, once the team here has had a bit more time to analyse the data and catch their breath, I'll analyse Atlas. So my outbreak investigation. So my outbreak was around a recent outbreak in relation to salmonella and alfalfa sprouts. And since then, there's been another outbreak of salmonella and alfalfa sprouts as well. So don't eat alfalfa sprouts pretty much. So in early June, an increases of salmonella Havana notifications were detected through routine surveillance at SA Health. So during the period from 2013 to 17, there were on average 13 to 14 cases reported annually to the Communicable Diseases branch of SA Health. And there'd been no previous outbreak in Australia attributed to Salmonella Havana. So the Communicable Diseases branch used the national case definition for salmonellosis. So that's a confirmed case which requires lab laboratory definitive evidence. So that's an isolation or detection of a salmonella species. And so every time someone feels ill, goes to the doctor and gets a specimen taken, that's grown, and then a sample is that's grown to see if something comes back. And then if it does, it's sent off to the salmonella lab here for further classification for species, and then we find out what particular type of salmonella it might be. So in this case, it was Salmonella havana. So when the CDC branch determined that, based on the number of notifications that they received at the time, which I think the first notification was back in, on the 1st of June, and then it was 2 weeks later on the 14th that they decided, after receiving I think 8 notifications in the period, in that 14-day period, that they should do some further investigation and follow up. So that's when they contacted those individuals and conducted a hypothesis generating questionnaire, which is a list of questionnaires, a questionnaire with a list of questions about what people have consumed in the 7 to 14-day period prior to them getting ill. And it's quite a long and intensive questionnaire about everything that they've eaten, where they've eaten, and whether they've travelled, or has there been anyone else in the household that's also been sick. And so this is used to identify particular exposures. And so from those interviews of those particular 8 interviews, it identified that there was a high exposure to chicken, eggs, carrots, cucumbers, onions, lettuce, potatoes, avocados, and tomatoes. And also from those interviews, it also identified that there was a hotel, that there was also a hotel that 5 of those individuals had also eaten at. So that hotel was flagged and later investigated. So traceback and environmental inspections. So because the hotel was identified as a common source for 5 of those individuals, a local environmental health officer inspected the hotel and identified that sprouts were served as a garnish on all hot meals, along with snow pea shoots and lettuce. So samples were taken and collected of the alfalfa sprouts and the lettuce and snow pea shoots. Otherwise, the inspection was normal. There was nothing else to report of significance. So from that, the SA Health and PIRSA, which is our primary industry department here in South Australia. So those guys went and did further traceback, which is identifying the brand of the alfalfa sprouts that were used, as well as the supplier and the distributor of those products, and investigated the possible source or link to the outbreak. So in South Australia, we have 2 sprout producers, so they were both followed up and investigated, and inspections were carried out at both sites, and samples were collected from either sprout producer. And as well as following up the sprout producers, where other sprout products were sold or consumed in other products, they were also followed up. So we had a supermarket, a bakery, a fruit and veg store, and a health food store. And then the staff also conducted some random retail sampling, which is just staff going to supermarkets and collecting random samples of alfalfa and other sprout products. And then they were all taken and sent off for investigation by the lab. So the lab findings found that of the 18 people over the period who had been unwell, that they will return back for Salmonella Havana. Of the 7 samples collected at the hotel, 3 returned positive for Salmonella Havana. Of the random retail samples, 5 returned positive for Havana as well, and all implicated the same sprout producer. And then 51 samples from the implicated producer, 11 returned positive, with 6 returning positive for Salmonella Havana, and then another 5 returning back for Salmonella Orenburg, which is a different strain of Salmonella. And then of the other samples collected from the other sprout producers, 0 Salmonella were detected, which is positive for them. So when that information came back, and we were notified of those results, hours within the happening, an emergency order was placed under the Food Act to the producer to stop, to initiate a recall of their product, and then a media release and public health alert was made by SA Health to South Australians about the product and to return any products back to the place of purchase. So this is our Public Health Minister out front doing a bit of a media announcement with the products. So on the day before the media announcement, there was a decision to undertake a case control study. And so this is where the main part of my involvement in the outbreak. So we developed a hypothesis that anyone with an illness associated with a consumption of frequently identified foods from the hypothesis generating interview questionnaire. So we developed a case control study questionnaire based off of the questionnaire, the hypothesis generating questionnaire. And from that, we developed some specific questions in relation to the frequently identified foods that people had identified from the questionnaire, and developed our own questionnaire specifically for this case study. We then used a sample size calculation based off of the Victorian Food Frequency Study, which estimates the prevalence of eating sprouts to be 3%, and then also from a percentage of cases that consume sprouts as well, identified that 30% of those people had consumed sprouts during the period of illness. So our case definition for our cases was a lab confirmed case of Salmonella Havana in South Australia, reported to the Communicable Diseases Branch from the 1st of June 2018. And cases were eligible to be in the case control study if interviewed prior to the media announcement regarding the outbreak. And then our controls were unmatched, and controls were recruited from a list of randomly sampled, selected South Australians from the South Australian Monitoring and Surveillance System Survey, which is a random survey that SA Health conducts a number of times a year, and they call people who've been involved in previous outbreaks or other studies to be who are on their list of survey participants, and ask them whether they want to be involved in other investigations such as this one. So on the day, 268 individuals were contacted to determine whether they were available to participate, but also to whether they were eligible for the study as well. So individuals were excluded if they weren't contactable prior to the media announcement. reported being ill or had recently returned from interstate or overseas within the last 7 days, or if there was another member within the household that was also sick with diarrhea in the last 2 weeks. So for our analysis, was conducted using Excel and Stata. We did some descriptive analysis as well as some univariate analysis. So of our cases and controls, we had 18 in total for our cases, and we were able to have 54 controls, and we had an even distribution of male and females, and there was no difference really between the cases and controls for age and sex. So it was, even though we were unmatched, it was there was no difference between the two. So a descriptive epi, so diarrhea was the most reported symptom, as well as lethargy, fever, and nausea. 8 out of the 18 were hospitalised, which is quite high. And the median incubation period for those people with a known date of exposure was 1 day, which just demonstrates the extent to which the severity of the salmonella on this product. And the days unwell range from 4 to 23 days, but the median days unwell is 10 days, which is not good. So this is the epi curve of all of our cases for that period. So the dark blue columns are for those that were included in our case control. And then the light blue are the ones are our additional cases that were involved in the outbreak overall. So there were 18 in the dark blue and then the 13 in the light blue. So first notification was on the 1st, but the first person being sick was on the 29th. So their incubation period was a couple of days. But then we can see on the epi curve that it was, I think, 8 of those first cases were the result of people who had eaten at the pub. And so we knew quite early on that it was the alfalfa sprouts to blame for this particular outbreak. So our analysis clearly demonstrates that overwhelmingly it was the alfalfa sprouts. Our odds ratio of 26 is significantly higher than any other odds ratio, plus our confidence interval also doesn't include 1, and our p-value also demonstrates that it's significant. So there was no further need to do any other multivariate analysis because no other food exposure was significant. So overall, 31 cases were linked to the Salmonella Havana outbreak. As stated earlier, no previous outbreak had been attributed to Salmonella Havana in Australia. So this is the first outbreak to be. And then internationally, there's only ever been 1 outbreak in 1998 in the United States linked to Salmonella Havana and alfalfa sprouts. And just like to acknowledge the rest of the team that were involved in the outbreak. And that's it. Thanks.
Thank you very much, Stephen. And as I said, I'll send you my general feedback on the whole presentation. But I only have 2 major questions to ask. Were they able to determine how the alfalfa sprouts were contaminated? And so what the source of contamination was? And the other question I had, because when I looked at the epi curve, I wondered whether or not some of the other people had infected each other. So were any of the cases linked whereby someone hadn't eaten alpha sprouts, but might have been affected by another person in their home or anything like that.
Yeah. So your first question, so alfalfa sprouts, the seeds that they use for alfalfa sprouts are lucerne, which is predominantly used as grown for feedstock.
Okay.
And so the seeds are contaminated already because of the way in which they're grown and produced.
Oh, okay.
And so during the production of alfalfa sprouts, the seeds should be treated with an acid solution to minimize the risk of any contamination.
Okay.
And so through this investigation, it was hard to determine what the likely source of the infection was.
Okay.
Whether it was cross-contamination or the seeds weren't treated at all.
Oh, okay. All right. I just wanted to clarify that because one time we had an outbreak in Africa, and I can send you some of the slides, and we had a similar epicurve like that. But this was not salmonella, this was cholera. So initially people were drinking contaminated water from the rivers where people were pooing, but eventually what happened afterwards was people were infecting each other at home.
Yeah.
So then for example, when you look at the epicurve, you have someone right at the end, and that's what happened with us. So we have this blip that goes up where so many people drank from the water source, and then what pushes the curve out is that people infect each other at home and through other means.
Yeah.
Okay.
Yeah. Yes.
All right.
Second question. The answer is no. Yeah, so there was no infection from other people from the household. Normally that does happen, just because people are sick and they don't usually tell anyone, and so yeah. But the main reason for people, that's fine.
All right, thank you, and it's good to see that the epidemic was contained in a short time period.
Yeah, we were quite lucky. From what I get told is that they don't often get the chance to do a case control study with an outbreak. So so I was quite lucky.
All right. Thank you very much, Stephen. Does anyone else have any questions? James or Claire?
I was going to ask less about the outbreak, but more about your layperson communications. Bringing that back to the CRE, because I'm so interested. Could you, when you've done your evaluation of the Atlas thing as one of your projects, could you do like a newsletter to the CRE collaborators and services about that?
Yeah.
Report on what you found? Would that fit the criteria?
Yeah, that'd be fine.
Yeah.
Because I've already done it. The one that I did for this one was a briefing to the minister. Yeah, that was fine. So, but I can do a newsletter or whatever else.
Yeah.
Good. Okay.
Back to the median age was 68.
Yeah.
Yeah.
Young people not at alfalfa sprouts, or are older people more susceptible to salmonella? Or?
Where was the hotel?
Yeah.
They have a really good senior special.
Senior special.
So the interesting thing with that pub was that because it was served as a garnish, not everyone recalled eating alfalfa sprouts.
Oh, okay.
The likely reason for that is that it was served as a garnish, so people just don't. So a lot of people, when they were interviewed, particularly the first time around, didn't recall eating alfalfa sprouts at all, and so we only had a small handful of people who did. And so that was particularly in relation to the pub. And so the likely cause for that, for people getting infected with sick, is that I think that the alfalfa sprouts were that contaminated that there was cross-contamination between them just sitting on their hot meals, that was enough to make people sick, even though they probably didn't eat the alfalfa sprouts themselves. There was enough of a contamination for people to get sick off of eating their schnitzel or steak or whatever. So,
and how did the lab know to grow salmonella? Have that, or is it broad? I don't know much
Yeah.
about that.
So they take a sample. Depending on what the product is, they take a sample or a swab of the product, and then take an agar plate, just the growing medium, and just do a swab, wipe the swab over that. They wait to see if it grows anything. Then they can tell straight away by on the plate what kind of organism it is. And then if they can see that it's salmonella, they send it off to the salmonella lab here. And then the salmonella lab will do further investigation to determine what kind of subspecies it is.
Are there other food groups with Havana?
Yeah, so Salmonella Havana originally was first identified back in Cuba in the early 1900s as a result of some babies dying due to meningitis. And I think there were maybe a dozen babies that passed away due to meningitis, and they found that the infection was Salmonella Havana, so that's why what it is. So that was back then, and so since then, because as in this example, seeds are contaminated due to the natural environment, because there's livestock, there's wildlife entering these fields where the seeds are grown. These seeds are naturally, so they're infected, and so because they're primarily used as feedstock, there's no need for them to be treated at all unless they're used for human consumption. So Salmonella Havana has been found in other animals, such as chickens, pigs, and I think cattle as well. So it just, because they're fed this stuff all the time, it's just sitting in their guts. People are told to, make sure that their chicken is fully cooked and we should be ready. So, and that's why Salmonella is also found in the egg whites as well. So,
I mean, there's been another food in Australia with the Havana. I'd say it's the first alpha.
Yeah, no, there's been no other outbreak of
Salmonella.
No,
that's good.
Yeah. Okay.
Where's the paper going to?
So the paper that I'm writing for this will go to I think it's the Emerging Infectious Disease Journal, which is the CDC journal. So we'll give it a go there first. It's also, the other reason for that is it's because the previous outbreak linked to falciparum and Salmonella Havana was in the US, so that's the US CDC journal. And also there's no fee associated with submitting the journal as well, so that's a bonus.
Right.
All right, I think that's great, and I think it's great that you're able to get an epidemic because if you for the 2 years that you're studying, one may not be able to get one, or there might be a crowd of other students trying to get in on the same epidemic. So I think it's really nice that you're able to get one.
Yeah, and it just means that it's now knocked out of the way, and
you can focus on other things.
Yeah,
because the program does look intense. It looks very intense.
Yeah, it's full on.
It's full on, yeah.
But hopefully at what's the next one?
The next meeting is early November. What we're planning to do then is having more of the PRPs that we invite them to the Central Advisory Board meeting, have more of a practice of a shorter kind of presentation about what they're doing.
So I'll do that, and then I'll have a bit more. I'll be able to present on my adolescent data analysis one next time. So I'll have some analysis from that to present.
Okay. Just one question, Stephen, about the adolescent one. Are you looking particularly at a particular disease like sexual health, or you're just looking generally across the board, mental health and other things as well?
So that particular study is just looking at hospitalisation in South Australia.
Oh, okay. All right.
So it'll look at the broad ICD chapters. so which are mental health. I think there are 20
Okay.
different classifications for the way in which they classify hospital admissions.
Mm.
And then there are service-related groups as well, which are broken down further into particular diseases. So I analysed that data using that classification as well. So there'll be a bit of broader stuff, but I won't look at anything in relation to STI until I do.
What age group?
10 to 24.
Oh, okay.
But I won't look at any STI stuff until I get to Atlas.
Oh, okay. All right. The one I was asking about was the primary health care, because I think there's a study you said you're going to looking at primary health care and meeting their needs.
Yep.
So that was the one I was asking, but that's fine.
Yeah, so for that, we won't know until we analyse the data.
Oh,
So
okay.
we'll just look at the data in the sense of what are adolescents accessing hospitals for at the moment, accessing
Okay.
primary healthcare service at the moment.
Okay.
And then we'll follow up with some qualitative stuff around speaking to adolescents and also health service providers about barriers and enablers and what are their needs.
In your hospital one, what about spontaneous preterm birth, ectopics, and stillbirth, and PID?
We could probably do that. It's just
They might be very small numbers, but over a 10-year period, there might be.
we can have a look. It would just mean because there are so many groups within that ICD classification, I can't analyse them all because it's just too many. But what we do know is that, particularly for young women, particularly when they reach that 15 plus age group, I think it's the first or the second reason for their hospitalisation. And so I think the aim is really to, once we've identified maybe the top 3 to 5 reasons for hospitalisation, we'll be able to look further in detail at drilling it down a bit further to see what it might be in terms of actual admission, reason for admission. So but I won't know until I look at the data a bit more.
Okay. All right. Thank you very much, Stephen. I know you're very busy, and thanks for taking your time to present to us. Okay. So if we don't have any more questions, I think I'll close the meeting so that we can get back to what we usually do. And we look forward to your presentation and other people's presentations in November.
Thank you.
Okay. All right. Thank you.
There.
Bye.